Financial Accountability Office of Ontario released a report on the province's spending plan, specifically looking at April to September of this year. It says the Ford government spending is $4.3 billion under budget, while the province added close to $700 million to support the fight against COVID-19. The FAO's report found the increase was offset by the $709 million left in the contingency fund. The FAO says most sectors spent less than planned.
The report led Green Party leader Mike Schreiner to release a statement today that reads in part, the Premier might claim he's saving the province money, but at what cost? The nursing crisis is at a breaking point. The wait list for autism services continues to grow, and schools continue to shut due to COVID-19 outbreaks. So let's discuss the nursing crisis in Ontario with Gritty Nurse podcast hosts Amy Varley and Sarah Fung, and Dr. Doris Grinspun, CEO of the Registered Nurses Association of Ontario, who just sent a letter to the Premier today calling for him to repeal Bill 124, which caps nurses' salary increases at 1%. So, Dr. Grinspun, what do you make when you hear that the province didn't spend as much as it planned in 6 months of this year?
So, first of all, we are not surprised. We have raised those questions before. And the exact question is what Mike Schreiner asked, at what cost? At the cost that nurses are leaving the profession, that the health system is collapsing, that surgeries are being canceled, that people have an opioids crisis like never before, that housing still is a major issue, and supportive housing too. So spend the money, Premier, and spend it well. Start by repealing Bill 124 so that we do not need to continue to have nurses leave this province to other jurisdictions.
Amy, I want to get your reaction. Nurses have been talking about a critical shortage for months now, and then you hear about underspending. How does that make you feel as a nurse?
It makes me quite upset and very disappointed because I keep on seeing the failures of the government. And, the biggest one is the fact that we still don't have paid sick days. Nurses have been voted down in terms of not allocating funding for sick days, and there's money, and they're doing nothing.
Sarah, when you think about where money could go, I mean, what is the workplace like for nurses right now?
It is really stressful. It is a battleground. And I think just to recap what was said, I think repealing Bill 24 is top of mind, but also putting more money into these internationally trained nurses who often spend thousands of dollars and years waiting to simply practice their profession. And these are people that are very much underutilized. I think we also need to look again at paid sick days and more resources towards mental health. We also need to look back on Premier Ford's promise to fix long-term care. That's been a long-standing issue. And we also need to end hallway medicine. This is a major issue in hospitals. I really feel that even for my own family, I have my own reservations about long-term care and even visiting the hospital right now. So it's an area of huge concern.
Dr. Grinspun, we're talking about numbers, so I want to be fair. The Ford government recently released its fall economic statement and says spending in healthcare will be going up by $541 million over the next 3 years, and says this will help hire more nurses and more PSWs. Does that give you any hope?
It begins to give some hope, especially in the area of long-term care. As you know, they announced also nurse practitioners for long-term care. That I think long-term care will end up being actually the silver lining of these tragic losses in long-term care in the pandemic. However, Bill 124 is the key to the door. Nurses are leaving because of Bill 124, especially RNs. They're going to the U.S. and other jurisdictions. And as you know, in our letter, we included a complete, fulsome plan, including what my colleague spoke about, the internationally educated nurses. Just so you know, almost 15,000 internationally educated nurses are waiting for their registration to be processed. So the changes are massive, and it's not only the doing of this government. It started, as you know, with the Premier Ford. It continued with some relief, but not sufficient, by the Liberal government. And now we are going full tilt again. But Bill 124 is the one thing that this government did that they cannot square it on anybody else but themselves. So that's where they need to start.
Amy, what is the conversation like among nurses when you talk about Bill 124? We've seen the protests at Queen's Park. We've seen the rallies. This bill would cap nurses' salary increases at 1%. Even these new nurses that we're talking about. What are you guys saying to each other when you think about this?
We're saying that we need to continue to band together and raise our voices. We're talking about going and knocking on doors. This is actually unprecedented. We're talking about being a part of the fight, being a part of the political voice and saying, you know what, if people aren't going to listen to us, maybe what we need to start doing in January, March, and February is to start knocking on doors and letting people really know what's happening in healthcare, because we're scared. And many, just today, I had 2 nurses tell me that they're packing their bags in and they're looking at going to completely different professions. This is a problem for nursing, and we're also just concerned about patient safety. At the end of the day, this is not just about us. This is about the healthcare of Ontarians, of Canadians. We're seeing that some of the most devastating impacts of the pandemic, Bill 124, and, hallway medicine, all these things. We just want the government to put the money where it's deserved, and that's healthcare and definitely education as well.
Sarah, so many nurses are walking away. Birgit Umaigba is an ICU nurse. She couldn't be with us today, but she's calling this a state of emergency. Do you see it that way? And do you think the situation has worsened in the last couple of months?
Oh, absolutely. I think that I've been in nursing for 14 years, and I have to say these past 2 years, in particular this last year, has been really a dark time in nursing. It's something that none of us have ever experienced before, and I really wonder if we can come back from this, if we can recruit back all of the nurses that have left and all of the ones that are continuing to leave. This is really something that is causing a permanent mark in the profession, and I worry that it's going to affect healthcare in the long run, because we're the backbone of healthcare. There are 100,000 nurses in Ontario alone. And really, I just feel like we're not replaceable, even though the Ford government is making it seem like we are.
So, Dr. Grinspan, more than $700 million in the contingency fund from April to September of this year. When we think about rebuilding the nursing profession in Ontario, are we losing time on investing in the problems and issues to correct them? Is it going to cost us more down the road?
Yeah, absolutely. Listen, I lived long enough in this profession and also in this province. And as you know, with Premier Harris, it started the situation. We went to the US to bring nurses. That was absolutely a joke at the time. So the time to rebuild is now. Start with Bill 124, then build bridging programs all the way from PSWs, RPNs, RNs, to all the way to nurse practitioners. Some of those initiatives are already in the books. I am working in 6 government committees, so I know what's happening. But none of them are talking about Bill 124. We know the Ontario Hospital Association is in support, even not vocal about that. We know even some ministers of the cabinet are in support, and the Premier just needs to save face and move fast and then start to rebuild. We are ready to rebuild with him and with any government and with any party. We are at the policy level. We are not about which party yes, which party no. So he needs to do it now because Ontarians need it, not because of him, not because of elections, but because surgeries are being canceled today. I know of several surgeries canceled today. I know of surgeries not being booked because there are not enough RNs in ICUs, in step-down units, in emergency departments. I know that people are dying, as we know, all of us, from opioids poisoning. The clinics have not been opened. The safe injection clinics have not been opened, and the list goes on. Time to move is, many years ago, but any day that we lose is a day too long for the crisis. And yes, we can recover. We have done the math of where the nurses can come, but with Bill 124, the door is shut. Nurses are not willing, and we are supporting them on that call of not being willing to remain in Ontario if the Premier digs his heel on that bill, because other jurisdictions don't have it, and certainly the US doesn't have it either.
Okay, we'll have to leave the discussion at this point tonight. Thank you, Dr. Doris Grinspan, RNs Amy Varley and Sarah Fung. We appreciate your time and insights.
Thanks so much.
Thank you, Rashmi, and to my colleagues. Thank you.